Thank you, Dr. Gulati. I apologize for my attire. I promised Marilyn I'd wear a suit and tie, but I'm actually on call, so there you go. But happy to be with you guys. Actually, this is probably the third year running that I've been doing this talk, and I've actually improved this, or I've not I won't say improved this, but I've changed it so many times because there's so many things that are evolving all the time. But the basis of this is. Um, I want to talk about things that I've learned along the way, and of course, very open to feedback. But I've noticed that certain things that we need to inculcate when we're a student, when we're going on to become an intern, and how you could be successful moving forward. But I think effective is the important thing. Yes, I've stolen the title from Stephen Covey's book. If anyone is ever interested in becoming effective, that's the book you go to. It's applicable to anybody in any career, and please do if you ever get a chance to read this book. So yeah, when I was in medical school, finishing medical school, moving on to internship, it definitely felt like, I'm in Top Gun, I'm ready for the big challenge. But you soon realize that there's such a very big gap between what we learn in med school and what we go and apply on the wards. So, yes, it's a great feeling to go help somebody, but I think it's important that there is a repertoire beyond knowledge that you need to have to be successful. And that's where, I'm a big fan of David Brooks. He is definitely not the most politically correct, but he wrote a very good book called The Road to Character, where he says, in the end, we humans are made of, two Adams or Eves. Eve 1, or Eve A, as he call it, is the ambitious one who would and defeat everything and climb all mountains. But Eve B, or Adam B, is the one who sacrifices himself for others and is all about the morals. But unfortunately, the sad part is that our culture, not just in medicine, talks more about success. Eve A or Adam A, where who should be successful and ambitious. So I want to concentrate on probably the Eve B or Adam B that's important with us. And, frequently when we think about medicine, this is the picture that comes into mind. I frequently, when I used to watch Scrubs in med school, I used to be like, gosh, what a life. I'm going to be just like JD. But, I felt more like House, to be honest. And yeah, he's brilliant and all, but, in many ways, there are times in which he was unhappy. I've been very happy with medicine, but I wish I knew certain habits or traits that I could inculcate in myself to get better at things. So habit number one, I'll jump straight right in, is, I can't understate how important it is that, you from the get-go learn how to manage your time, because in the end, it will, what will get you past multiple things, how to not just manage your time at work, at home, how you manage your chores, so many things, but evolve ways by which you can manage your time properly. If you can manage one skill, forget about the other six that I'm going to talk about. This is the one. And everyone has their own technique. I'm not here to lecture you about how to manage your time. I'm just saying, if you can, that's, I think, will be the number one thing you have to go for. They've tried to put that into papers by saying a review for physicians' time management. Believe me, there's not one formula that I could share with you. You have to evolve yourself. There's a very good one from a practical handbook for physicians from the Royal College of Physicians and Surgeons of Canada, if you would want to go through it, which I find the most practical, and it teaches us how to not just manage time of work, but also at home, which is very, very important and you should not ignore. And it's something you could definitely look up. But it's not just your time, it's also your energy, because you also have to think about it when you're on the wards. There are a lot of minute things that will be brought to your attention. You always have to keep looking at the bigger picture. Don't get drowned by, oh my God, I have to now address talking to this person while someone already is peri arrest or almost about to code on you. You have to go after the sickest and the most important thing. And most importantly, I think we are not really taught how to navigate the electronic health record, because it's such a bane these days to even manage that per se. So evolve ways by which you can even navigate the electronic health record. I have a way by which I go about it systematically. I would notice a lot of times, a lot of interns will be going about it in a very haphazard way, where you're looking at labs first, then vitals, then notes. No, have a system that you evolve for yourself. How are you going to gather information? We live in a generation of data overload. So you need to know how to synthesize information, and the electronic health record is a great invention, but is definitely very time consuming. And yes, it's one of the biggest problems these days. We already had physician burnout prior to electronic health record. Now it's more predominant in the current era. So learn how to navigate it from the start, even as a student, about how you're going to navigate it when you become an intern. And like I said, you have to go after the critical and the immediate tasks, not to be worried about the non-critical and uncategorized ones when it's important to go after the critical and immediate. Always remember that. And when you're working so much on computers, we forget the most important thing: paper. It's always great to work on paper. I know you'll be working off lists, but make a habit to write down labs in those. It'll really go a very long way rather than just printing things out, because you'll imprint them very well. Habit number 2, I put in Beatles. Whenever I used to give this talk, actually used to be live, I used to ask people, why would I put this? It's mostly because we get by with a little help from our friends. It's important, I think, to build camaraderie around you. We kind of underestimate the importance of camaraderie, which in many ways actually, has gotten me past so many hurdles in residency. So keep that going. Build as much of camaraderie as you can around you. As they say, no man's an island. It's so true. And above all, get good relationships with the nurses from the get-go. The number of times nurses have saved me is I can't even count, and they continue to. Even as a fellow, they continue to. So make sure you have good relationships with them, because they're the ones who are going to get you through major jams. It's not going to be your attending, sadly. And then, of course, as you build camaraderie, I think it's an important thing, because it also exhibits your leadership skills. There have been multiple studies about this, and have showed that, people who build good camaraderie are also great leaders. And this is, this is a big building block for you for your leadership endeavors. And, we're, of course, much happier when we're other people. So remember that and keep going with that. As you've seen, even taking a cue from the Avengers, nothing gets solved by being at loggerheads with people. We always defeat things when we're together. And has been shown by, again, I also want to make sure I'm quoting adequate scientific studies, and the camaraderie, where they've actually done a randomized clinical trial about this. That if you're trying to promote physician well-being, it's important to meet your colleagues even outside of work, because it's what will promote and sustain satisfaction. Habit number 3. I'm a big fan of actually Ray Dalio. Ray Dalio is actually a hedge fund investor. You must be wondering, why is this guy mentioning a hedge fund investor in a talk about internship? But we learn from other lines of work too, and that's what's important. So when we're becoming interns, we're trying to establish our own identity, and we tend to get very closed off in trying to preserve that identity and to build on from there. So get very closed off to other people's opinions. So it's important to be open-minded from the get-go. Even as an attending, as a senior attending, as a professor of medicine, I think it's important to keep open-mindedness about other people's opinions. Just 2 weeks ago, and a medical student pointed out to me, a lab that I was missing, and a very important one. I could have easily not listened to the student and just quash it off, but it's important. Have open-mindedness for diagnoses or opinions, even. It's a very important trait. And and it's not just cultural diversity that makes us smarter. It's the whole team per se. Listening to, say, a physical therapist or a nurse, very, very important thing. So it's important to realize that diversity, not just in culture but also in ranks, makes us smarter and makes us more intelligent or creative as a team. And Ben Franklin used to talk about this over and over. It's important to listen. It's important to listen rather than talk, and it's something that we should keep all throughout our medical careers. And as I mentioned, I keep talking about being a more effective leader. Even Forbes magazine said so. You have to, if you listen well, you become a better leader. Habit number 4. Sometimes complaining feels so good. Believe me, I'm guilty too. But I think sometimes you can get into this circuitous loop where you just can't get rid of it. I think it's very important to realize that excessive complaining, which we sometimes get into. Atul Gawande mentioned in the postscript of one of his books, Complications, that he was once sitting for lunch with all his colleagues, and all they could talk about was complaining about the hospital. I think that's not something we should go for. Try to check that as much as we can. Believe me, I'm no model for that dictum, but I think it's really not good for you, because it spurns negativity and, of course, makes you not look for solutions when there should be. And it, like I said, it rewires your brain for negativity because in many ways, complaining actually literally shrinks your brain too. And I'm not just pulling that out of a hat. It's from studies from Stanford and Yale and Harvard that have brought in, that it's not good for your wellness. And in the end, if you're reducing on complaining, it actually makes you less stressed and have more gratitude and improves your health. And of course, strengthens relationships. Habit number 5. I know I'm going a bit quick, guys. I apologize. But I think these are, I wouldn't say exactly self-explanatory, but I think you're getting the gist as we go along. It's okay to ask for help. As I said, when we're interns, we're trying to build an identity for ourselves and, assert our independence. It's okay, remember, to ask for help from the get-go, however senior you get, because like I say, it reveals strength and not weakness. So if anytime you're not happy about something, or you feel like a patient is going to get sick, and it's almost like a spidey sense, right? If you feel that this is something that's not right, say it, because it might end up saving someone's life. Coming to the last 2 habits, habit number 6. So one of my favorite paintings from I think it's from Monet, where I think one of the books by Walter Isaacson, Steve Jobs, talks about that your work should reflect art. Now you must be wondering, how does that pertain to medicine? I think it pertains to every line of work. Whatever you do, it should be artful. Not just artful, but meaning excellence. It should portray excellence and always be exuding that. And Steve Jobs said it so right. He was like, make sure you go out there and infusing excellence into your work, and making sure you pretty much strike a dent in the universe. And and this is how you become effortless. We revere sports icons, and you could see in each of these icons, even when they're playing their most masterstroke, it's effortless. And that's how you get there, is by infusing excellence as much as you can with each step. It won't be possible every minute, I'll assure you that, but wherever you can, in your interactions, in your notes, in your management, even while you're talking to patients, I think it's important to have that excellence, so that at the end it becomes effortless for you. Coming to the last habit, I think we forget that very often, since medicine's a science. I know it involves people, but we forget to talk to patients well. It happens quite a bit. You must be wondering, as students right now, I talk to my patients for at least half an hour whenever I do a history. That's great, to be honest. But as time becomes a constraint and you're busier, it's one of the things that does get affected. So remember, this is why you got into medicine in the first place, to help people. And it's the conversation that comforts them the most, because it's those conversations at pivotal moments that will grant them comfort. Whatever medication you give will be there, but you can't really replace that good conversation that you have with them, because that's what adds value to your interactions. And then above all, we all got into this, as I mentioned, to help people, but the hospital is pretty much the last institution that people can turn to, especially who are socially deprived or financially deprived. Hospitals are the last institution they can turn to. So remember, you're pretty much the only person at that time that can help them, not just in illness, but generally in life. So I think if you could keep that going, I think that's why we got into medicine in the first place, and be happy and make sure everyone is looked after. But thank you. That's the end of my talk. I think I have 1 minute to spare. Any questions, please let me know. Thank you.
That was a great talk. Thank you. I want to just say that every time I think you said your 3rd year you're giving this, every time I come away with one more pearl of wisdom, and I think your words to say conversation comforts. And I think to me that really resonates, because in the constraints of time, we forget sometimes that is really what the patient is looking for, is conversation.
Yeah.
Great. Any questions, comments?
Yeah, I can add more habits or change habits, guys, if you think, very happy to change them. I have altered them as time goes along.
I actually have a comment, if that's okay.
Sure.
I'm Shannon. I'm a 4th year medical student with Saba University. With that last point, that the hospital is the last place that patients go to, a lot of times I found that you're meeting the patients for the first time, trying to get the information, but you're seeing them potentially on one of the worst days of their lives too. So when keeping that in mind and being empathetic, I've been able to get a lot more information out of patients through their story and understanding how they're framing what they're saying in that way. And that's really helped me out.
Yeah, no, for sure. That's a great point, Shannon. You're already way ahead of the league when it comes to that. So that's amazing. Thanks for the insight.
Sam, Dave Wiseman here.
Go ahead, Dave.
I thought great talk.
How you doing, sir? Thank you.
Absolutely. I always say, there's so much special things during an intern year that an intern develops their skills. And you nailed a lot of the key areas that I 100% agree with. I think observation, listening skills are huge. Listening to our patients, open-minded, and ultimately being able to tell sick versus non-sick, I think is a key skill from an intern, in addition to all the things you mentioned about, keeping on task, identifying priorities. So yeah, that, and I think, how do you get to tell, who's sick and who's not sick? Well, it's keeping a keen observation and keeping your ears open, keeping your eyes open, all those keen senses at all times will build that skill.
Yeah, no, thank you for sharing that.
Great, thanks, Simon. We look forward to hearing your fourth talk next year in person.
Yeah, look forward to that. Yeah, no, look forward to that. Thank you.
Great.
Thank you for having me.